So ultimately, radiation is very much a local treatment. I guess you can, it's unlike the chemotherapy or hormone or some of the other sort of other molecular treatments, which are general treatments. Radiation is a localized treatment. And for us, when we design or plan the radiation treatment, we have to work out exactly what it is that we need to treat. We bear in mind everything around that could be potentially harmed or injured by the radiation, and that's how we sometimes decide the technique that we use, the dose that we give. And so part of that is that once we've decided where it is and how we're going to aim at that area, we need to put some kind of reference mark onto the outside, because that's what we have to use to start the initial lining up process. So yes, as part of that, we do use like a permanent mark that we can come back to and use that as our starting point. In the past, we have sometimes just used we used to use marking ink that was in theory indelible, but would always get washed off. That would be a problem sometimes if marks disappeared. Or they, smudged. So what we do really nowadays is a permanent mark. It is a tattoo. It is literally just a tiny little blue or black dot, smaller than most freckles, but it is permanent. And often there's a number, it's not just one. So often for, let's say if you were treating a breast area, there would be one kind of in the middle and one to one side, so that we can use that not only to kind of line up, but we can level and make sure everyone's nice and straight and even if we've got more than one mark. The only exception, I guess, is if we were treating somewhere around the head region, where sometimes we might use other devices, and obviously you're not going to want marks on your face or around your neck. So in those cases we actually make a specialised mask and we put the marks onto that.